So I'm in procedures clinic today, and there's a lot of cool procedures lined up for today. Last time when I was here, it was primarily like colposcopies that we did, but today there's a wider range, so I'm looking forward to working on that and getting more experienced. I actually have done every single procedure that we do have lined up today, but it's always better to have more experience and to become more and more confident, so looking forward to it. What were you doing today?
We did colposcopies today.
Oh, that's pretty cool.
Yep. So it's pretty cool to do it as family medicine residents.
Yeah.
So
What are you looking at over there?
So just this is a good book to look at images of different cervices, and
Do you feel like it's helpful to look at that, like before you go in, just have an idea?
for sure. You should always try to prepare a little bit before a procedure. It's a good rule for any resident, like any procedure.
Preparation is good. Okay.
And you learn more when you actually know what you're looking at versus just learning on the spot.
Yeah, cool. This is our wonderful preceptor for today, Dr. Whitman.
I am more than a preceptor to you.
Yeah, he's also
the director, also known as God.
My boss.
Yes. But yes, we're in procedures clinic today here at ECU Family Medicine in Greenville, North Carolina. We have our own procedure and skills clinic here in our family practice clinic. We do a variety of outpatient procedures here, including basically any skin procedure you can imagine. We do cryotherapies, we do shave biopsies, punch biopsies, we do surgical excisions, we do INDs, we do lipoma removals, we do circumcisions, we do lots of gynec procedures here as well, colposcopies, endometrial biopsies, we do LEEP procedures, we insert IUDs, we insert Nexplanons and remove those devices as well. What else do we do? We do vasectomies here. We do exercise stress testing here. We do pulmonary functioning testing here. We do OB ultrasound here on our skills module. Right next door we have our sports medicine clinic, and we also do joint injections that are ultrasound guided in that clinic.
That's so cool.
We do nail avulsions, diabetic nail care.
I almost fainted that one time.
So we do a lot of procedures here.
That's pretty cool. So what do we do today?
Well, today
Just a range
the
of
theme
procedures.
is mostly women's health. We have a large amount of colposcopies that we're doing this morning,
That's exciting.
with a couple of skin things and nail things, but predominantly women's health.
So do the residents get to do all of that?
They do once they've passed the sniff test, so to speak. So when they work with us attendings, we talk to them about the procedures, they read up about the procedures. When we go into the exam rooms, they watch us do these procedures. And then once they've watched us do some of these procedures, we let them get their hands dirty and start doing some under guidance with us. And by the time they finish, they should be pretty well seasoned.
That's pretty cool. So is this something that is different for the rural track?
Well, the rural track has the opportunity to be here in Skills Clinic, just like our standard program residents, but we also designed some curriculum that's specific to the rural track. Obviously, when our rural residents are out in the rural communities, those hospitals are smaller, they have less resources to draw upon, and you may be the only person there that can be counted upon in case of an emergency. So we have a special skills elective for our rural residents that also focuses on a number of inpatient skills, including how to respond to codes. So they spend some time with our emergency response team, responding to codes, running codes, etc. They spend some time with the PICC and vascular access team, learning how to do hard sticks, learning how to place and remove central lines, things of that nature. And they also spend some time with anesthesia in the OR, learning how to safely intubate patients in a controlled environment. and they spend some time with the respiratory therapist there as well in the OR, learning how to manage vent settings and things of that nature. So in total with that, they also spend time here in the here in the procedures clinic, and they spend some time with me over in the wound and hyperbaric clinic, learning how to surgically debride wounds and manage hyperbaric patients.
That's gonna be so cool.
Lots of cool stuff.
Yeah, we'll keep you guys posted. Stress testing.
I'm gonna point your ultrasound.
Ooh.
Take patients into the room, put them on a treadmill.
Make them do exercise.
Have them exercise. We monitor them. Exercise stress test.
Are you going to demonstrate?
No, I am not a runner.
Dr. Whitman's going to demonstrate now.
If you see me running, you should run in the same direction.
We should all run.
Something terrible is coming from the other way.
We have a patient in here. But you can do ultrasounds in there. Dr. Whitman, we're going on an adventure.
So this is the room that we typically do our skin-based procedures in. So punch biopsies, shave biopsies, lipoma removals, circumcisions, toenail avulsions, toenail trims, those types of things get done in this room. And this room has been stocked for those types of materials.
These are all the things.
We have a bifurcator in case we have a patient that bleeds significantly, so we can stop that. We have a storeroom here in the center.
These are all the things.
This is our gynecological procedure room, so colposcopy, endometrial biopsy, LEEP procedures, Nexplanon removal and insertion, IUD removal and insertion. Those things happen in here.
Cool. Look at all this cool stuff in this room. It's set up a little bit differently. And what's that, Dr. Whitman?
This is the scope we use for our colposcopies. It basically shines bright white light and green light so that we can examine the cervix after we place acetic acid on the cervix to look for acetoid change and hypervascular. To the computer so the patients can actually see in real time what we're looking at, and we can explain to the patients what we're doing while we're doing it.
That's really cool.
And if you step out, right next to us is our sports medicine module, where we do all kinds of cool stuff. We do ultrasound guided joint injections, we do Euflexa injections, and other stuff like that. So
That's so cool.
casting, splinting, all that kind of stuff.
It's me and Dr. Whitman.